Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. And just before we go to the updates today, news just in following the insecurity situation in the country. Well, Governor of Zamfara State, Bello Matawale, has ordered the immediate closure of all boarding schools in the state. This comes after 317 students were abducted from government's girls' secondary school in Jagebe in the early hours of today. Meanwhile, the force headquarters has deployed 2 surveillance helicopters to the area and its environs in search of the abducted girls. A statement from the force's public relations officer, Mr. Frank Mba, says the surveillance helicopters will complement the efforts of Operation Pofadder. According to him, the Inspector General of Police, Mohammed Adamu, has also condemned the abduction, describing it as barbaric and callous. He also says the joint rescue operation is being carried out by police, the military, other members of the law enforcement community, with support from the state government and other stakeholders. We have more updates on that situation as it unfolds. Now back to the COVID-19 update. Tomorrow, the 27th of February 2021, marks 1 year since the Federal Ministry of Health confirmed the coronavirus disease in Lagos State, Nigeria. The case, which was confirmed on the 27th of February 2020, is the first case to be reported in Nigeria since the beginning of the outbreak in China in January 2020. The carrier, an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos on the 25th of February 2020, was confirmed by the virology laboratory of the Lagos University Teaching Hospital, part of the laboratory network of the Nigeria Center for Disease Control. And ever since, Nigeria has continued to record more cases of COVID-19 having entered the community spread stage, with total confirmed cases at 154,476. Not only that, along the way, families, friends, loved ones have died, with current figures at almost 2,000 cases. But there is some good news, and that is the number of recoveries which continues till this day, totaling over 131,000. Some managed at home in line with the guidelines, while others are managed at different treatment centers in various states. While Nigeria continues to record more cases since the announcement in December of the second wave, 634 new cases were reported last night from the NCDC. The government of Nigeria, through the Federal Ministry of Health, the NCDC and other agencies, have since been strengthening measures to ensure the outbreak in Nigeria is controlled and contained quickly. Yet, most states still struggle to contain the infection, ranging from disbelief of the virus, ignorance of the non-pharmaceutical guidelines, to absence of resources for crowded schools and facilities to maintain the protocols, or even welfare issues for frontline workers, and many more. But thus far, the Southwest has remained in the lead, with Lagos, the epicenter of the pandemic, having over 55,000 cases, followed by the FCT, Plateau, Kaduna, Oyo, and Rivers are at the bottom 6. The federal government's efforts to manage the coronavirus pandemic got some boost with donations by the German government and the European Union of protective equipment worth 10 million euros. Representatives of the donors reiterated their preparedness to collaborate with the African region and ensure that the pandemic is eradicated. We have more on that report later, but let's tell you that Côte d'Ivoire, outside Nigeria, has become the second country in Africa to receive the COVID-19 vaccines from the COVAX facility. 504,000 doses of Oxford AstraZeneca vaccine arrived in Abidjan earlier today. According to the World Health Organization, it is another step towards vaccine equity and a symbol of global cooperation and solidarity. Côte d'Ivoire is to launch its COVID-19 vaccination campaign on Monday, the 1st of March 2021, with frontline health workers and essential staff being among the first to receive them. Ghana earlier in the week received the COVID-19 vaccine doses shipped via the COVAX facility, the first country to do so, and it got 600,000 doses of the AstraZeneca Oxford vaccine from the Serum Institute of India. And Delta State has recorded confirmed cases of COVID-19 every day, but one in the last 6 days. In order to check the situation, the state is asking residents to comply with the non-pharmaceutical interventions and other COVID-19 protocols. Well, to ensure its success, the state is deploying the services of the police command to enforce the preventive protocols.
Following the trend regarding enforcement of COVID-19 protocols. Firstly, curfew is being enforced. Once it is 10 o'clock, take a ride, move around within the metropolis or any of these cities. You hardly see people. Policemen have taken over everywhere. And it remains so until 0400 hours of every morning. Nightclubs have all been shut down. There's no clubbing, no partying again. Wearing of face masks, people are complying. All these are measures put in place and are being enforced to ensure that we have a reduction in the spread of this disease.
Let's look at Nigeria's journey 1 year into a disease that has killed over 2.5 million people worldwide. Dr. Yahya Diso is the Head Risk Communication Division of the NCDC. He joins us virtually. Welcome to the program.
Welcome, Millicent. Good evening, Millicent. Thank you for having me.
Thank you for joining us. How would you assess the national response since Nigeria's index case? Do you see any gains in the midst of the losses, human, economic, and otherwise?
I would say there has been some tremendous progress in the last 1 year, increase in public health infrastructures across the country, both at national and the state level. You will agree with me that last year, as at this time last year, we only had 3 laboratories that can confirm COVID-19 in the country. Then we have over 100 in our laboratory network across all the states of the Federation. So that is the first thing. Then another thing is the public health workforce. They are more experienced in terms of public health preparedness and response, and they are committed to fighting COVID-19 in Nigeria. And this will also be extended to other public health diseases, like meningitis, CSF, Lassa fever, measles, and so on and so forth. And then we also commend the members of the public who have also complied with the protocols in a way. We know that over time people got tired because of the economic impact of the lockdown, and then sometimes sacrifice have to be made with regards to livelihood, and there has to be a balance between life and livelihood, and also the liberty, because we have to sacrifice some things. There are things we do socially because of social distancing, physical distancing, and wearing of face masks, and all these has implications for our social life. But then this is going to be for a while. All we need to do is all hands must be on deck for us to be able to achieve our common goal, so that we can resume our life back to normal. As also, I want to really commend the leadership. They've been resolute, they've been consistent, even though there are still gaps here and there. And things have actually improved compared to where we were before now. Our partners have supported us tremendously in this regard at international level, at local level, the civil society organization, our social-cultural groups, the religious leaders, and we want to commend everybody. This is the time for us to reflect, to remember those who have died, pray for those the lost ones, the relatives of the lost ones, the ones that have died, and then also pray for the frontliners who have been in the forefront of this problem. This does not include the healthcare workers alone. And this is also the time for us to review our strategy, our activities, to see what we need to do differently so that we can move to the next step. This is opportunity for us to improve our system, and particularly the collaboration across NDAs. It has never been like this before, across all sectors, across all levels. We've been working together. That's one great thing COVID-19 has done for us. It has united us. And then I think we are better for this. But the important thing is we should not lose this. We should not go back to business as usual. Vaccines are coming. And when they come, we take the vaccines. We are all hopeful that these vaccines will put a rest to all these problems that we're going through. And we look forward to that day that we don't have to wear face masks in the public, and all of us will be happy for it, and we can hug ourselves, and the burden, there is a price to pay before we get to that level. So we want to hold Nigerians to ensure that you continue to comply with the non-pharmaceutical intervention. They are very important. Vaccines will only prevent the severity of the disease. One can still get it and transmit it, but the vaccine cannot go around to everybody for now. So because of that, we all need to make sure that we support the process for distributing this vaccine, making sure that people who are prioritized get this vaccine, and all of us complement it with our compliance with our non-pharmaceutical interventions like hand hygiene and regularly wearing of our face masks, physical distancing, and this should be in all sectors: education, transport, industry, private sectors, wherever. And then the media, the media, they've been really trying, especially in the era of infodemic management, misinformation. So media have also been in the front line, fighting day and night, attending all the press briefings in detail. It is not easy. And many times they keep tracking us for, for media queries. We need to respond to this, respond to that. And we all know that some way we may disappoint in some respect because there are priorities here and there, but we all need to understand. But the stronger, the data, the stronger, we can always do that better when we all work together and we all collaborate together, understand where our gaps, our differences, and then see how we can use our differences as a way to build better relationship for improving our health system, improving our society, and improving the lives of our citizens in Nigeria.
Dr. Disu, I must ask you, because you mentioned vaccines as, while we wait for vaccines. But the question is, when are the vaccines really going to come? We're seeing neighboring countries in Africa, Ghana, Cote d'Ivoire, getting the, very first share. So why the delay? What can you tell us?
Anyway, when it comes to vaccines, the National Primary Care Development Agency is the authority on the vaccine and its related matters. So they have the details of when exactly we're going to get the vaccines. But we know that we're going to get these vaccines. There are arrangements, logistics that have been put in place, communications, and to ensure that the people who need to get this vaccine are aware and preparedness for this. And of course, you know that the Nigerian population is very huge. So the quantity of vaccine that will come to Nigeria, we need to be able to match it with the adequate level of preparedness and then the logistics it's required. We're going to get it, and it's something that all of us are going to smile by the time these vaccines arrive. I don't think we should bother ourselves so much.
I'd like to thank you. Dr. Yahya Disu is the Head Risk Communication Division of the Nigeria Center for Disease Control. Thank you for joining us at this time.
Thank you for having me.
We have more on the COVID-19 update when we return. Please stay with us. And earlier today, Dr. Matshidiso Moeti, WHO Regional Director for Africa, assured of the coronavirus vaccine safety as the COVAX initiative rollout continued.
This is a very positive milestone and moment for us in Africa as we now contemplate and observe that the COVAX facility has started to deliver vaccines, and of course we're looking forward as well to the African Union doing the same and the country's own bilateral efforts. We hope still for the global solidarity that our Director General has mentioned so many times to translate from the wealthier countries. There are some who are contemplating donations of some of their supplies to African countries. We would encourage this very much. To our communities in Africa, we'd like to say this is a moment to seize when your turn comes to receive the vaccine. The vaccines have been thoroughly looked at. The data is sufficient in terms of safety. Please accept this vaccine. Let's take this opportunity so that we put our economies, our healthcare systems back into normal operation by everybody playing our role. And then finally, please, The public health measures are also very necessary. Please wear your mask still. Please keep your distance, and please sanitize. So these collective efforts are what is going to bring Africa out of this crisis.
Now let's take you back to the earlier report of the boost the federal government got, and this is from donations from the German government and the European Union of PPEs worth 10 million euros.
Officials of the European Union and the German government are here to donate critical equipment to the Nigeria government for the management of COVID-19. COVID-19 has, in the last 1 year, continued to ravage the world, and in Nigeria, 146,000 persons have been infected by the virus, leading to at least 1,761 deaths. Efforts to reduce and effectively manage the pandemic is the reason why the European Union and the German government are lending this helping hand to the federal government.
What we are doing right now, and what is the plan to further expand in hopefully a next program phase, is the approach on One Health, which will include, for example, to bring together the human, the animal, and the environmental health sector and issues in establishing integrated disease control mechanisms for the region, as well as the provision of tailored trainings on One Health for public health professionals.
Our thoughts and prayers are with the families, friends, and communities impacted by this pandemic. We, however, remain confident that our global collective will enable us to emerge stronger together from this tragedy.
While thanking the EU and the German government for the gesture, both the Minister of Health and the ECOWAS representative call for a sustained collaboration in order to effectively manage the pandemic.
We like to again say that this should not be the end of collaboration. We continue to talk to each other, to learn from you. And I must say that we learned a lot from just looking at the news and the responses in Europe. We learned from all the successes and all the steps that we are taking. We also thought we identified some mistakes that were made, from which we also learned of what is happening in America and what happened in Europe, because the advantage of being able to look behind, walk from behind, is watching those who are in front and seeing what they did so that we do not repeat the mistakes.
This is a clear statement of the strength of collaboration and partnerships in ensuring inclusive, sustainable development of our region. Therefore, permit me to commend the hard work and commitment of the leadership of the GIZ for ensuring these much-needed critical medical supplies and equipment.
The equipment includes ventilators and personal protective equipment. While Nigeria awaits the arrival of vaccines, these donated items will no doubt help the government in the management of the pandemic and reduce fatality.
Now, EU leaders are vowing to speed up vaccine production at a two-day EU COVID-19 summit. At the top of the agenda is the EU's vaccine rollout, which continues to lag in fears as virus mutations continue to mount. Deutsche Welle correspondent Chelsea Delaney joins us from Berlin. Hello, Chelsea. EU leaders kicked off the summit yesterday. What were the takeaways from the first day of the summit?
One of the main takeaways from yesterday's summit was that the EU is still very confident that it's going to be able to vaccinate 70% of the adult population by the end of summer. There had been a lot of skepticism of this target given how slow the rollout has begun here in Europe. Only about 8% of the adult population has been vaccinated so far, and that's compared to rates of around 25% in the UK, 13% in the United States. So the EU EU is clearly lagging behind. One of the big problems has been that the EU hasn't received as many doses of the vaccine as it thought it would in this first quarter. Some of that is expected to improve in the months ahead as the EU has negotiated with many manufacturers to increase production here in Europe. So there should be more and more doses coming to the EU. But there's also a big problem on the local level. Many countries aren't using all of the supply that they have. France, for example, has only used about 50% of the vaccines that it's received. So there are also a lot of distribution problems, and millions of vaccines are for now not being used. So the EU clearly has a lot of work to do, but they still are really putting an optimistic spin on the fact that they do think we will start to see vaccinations increase in the months ahead.
Officials also discussed proposals from countries like Greece and Spain for a vaccine passport that could allow people immunized against the coronavirus to travel more freely. Is the EU behind this idea?
This is probably the most concrete outcome of the summit. The EU has decided to create a digital vaccine certificate that would be recognized across the EU, but also potentially across the world. Now, what this vaccine certificate will actually mean is a bigger question. Some tourism-dependent countries in the EU, like Greece and Spain, and really want this vaccine certificate to allow people to travel freely again. Other countries have been more skeptical of using a vaccine certificate to give vaccinated people special privileges. Germany, for example, thinks that that would be unfair to people who haven't been able to get the vaccine yet. So there still has to be decided how this vaccine certificate would work, whether it would give people special privileges. But the EU is going to develop one, and they expect it to be ready in the next 3 months.
All right, Deutsche Welle correspondent Chelsea Delaney, Mary, thanks for that update. Now, experts in the UK say vaccinating people in order of age is the fastest way to cut COVID deaths in the next phase of the rollout. People in their 40s will be next in line, followed by those aged 30 to 39, and then those aged 18 to 29. All 4 UK nations will follow this approach for vaccinating people. In the meantime, continue to take responsibility. If you have symptoms associated with COVID-19, please visit one of these sample collection sites in your state to get tested. You can visit our website, channelstv.com, for more updates, a better understanding of the pandemic. You can also find other stories making the rounds in Nigeria, Africa, and across the world. That's the program this evening. Thank you for watching. I'm Millicent Nwonka. Stay safe.